We're here to talk about nursing vigilance from the Northwestern Theory Nursing Practice class. We're going to start by kind of defining the word vigilance. It's defined as a state of watchful attention, of maximal physiological and psychological readiness to act, and of having the ability to detect and react to danger. In nursing, vigilance is the essence of caring, and it's the root of nursing, thought by Nightingale to be the most important skill a nurse could possess. And when we looked at the published work, we found that according to Meyer, vigilance can be described as the mental readiness of the intellectual work of the nurse. And the nurse must learn to attach what is or what might be in order to anticipate and plan for what might occur. Caring in nursing differs from any other healthcare profession or any other profession in that the professional vigilance is its hallmark.
Hi, my name is Chasity, and I'm going to talk about the purpose of the concept analysis. The actual concept analysis itself is the process of reviewing the basic fundamentals of a concept. The concept analysis of professional nursing vigilance, as relates to our paper, is to define and distinguish the role of vigilance to the nursing profession through the actual act of caring. Some definitions and defining attributes of vigilance. We looked at some terms that can be substituted for vigilance, such as watchfulness, attentiveness, and alertness. The ability to assess the patient and remain watchful and alert for any decline, and the readiness to react within seconds is a necessity in the nursing profession of vigilance. Defining attributes that have been defined with the literature include attentiveness to important clinical changes, computation of possible dangers, and rapid responsiveness to complications.
I'm Amanda, and I'm going to continue talking about the definitions. Vigilance is more than activities carried out by the nurse, such as medication delivery or catheter care. We're also looking at the thought process entailed in providing the care. A definition of vigilance in nursing has been developed. The mental work necessary to attune to the significant clinical changes, compute possible dangers, respond rapidly to the diminished complication of the patient.
Now we're going to talk a little bit about our case studies that we did. First off is the model case, and according to Walker and Advent, a model case is an example of a concept demonstrating each of its defining attributes. And according to Chen and Kramer, they define a model case as a description or this depiction of the situation, experience, or event that satisfies the following statement. If this is not X, then nothing is. The case study that we put together for that is a nurse with 6 months experience, Jane, enters a room of a patient at the beginning of her night shift. The patient is an 11-year-old male that has had an open reduction of a left wrist fracture with rod and pin placement. The patient is 4 hours post-op with a soft cast which extends from the mid-hand to forearm. He is sleeping soundly along with his mother when the nurse enters the room. She performs her routine assessment of the environment, finding it within the safety standards. Upon her assessment of the patient, she finds his left arm elevated with the cold compress in place to the left arm. Further assessment finds fingers are warm and pink with adequate capillary refill. She performs the entirety of her physical exam, cautious not to wake mother or patient since she knew they were both tired. The nurse makes routine checks on the patient every 2 hours throughout the night and is pleased that he has slept throughout the night. All of her assessments have resulted in baseline findings. During walking rounds the next morning, the oncoming nurse, Tracy, who has 10 years of experience, enters the room with Jane. The patient remains asleep. Jane reports her findings and proudly states he slept all night without waking up. Tracy asked if sensation and movement was assessed, and Jane stated no because the patient was asleep. This assessment is crucial to a successful outcome for this patient and was not done during the 8-hour night shift. Jane's lack of vigilance could negatively impact this patient. So while Jane was vigilant in caring for the patient, she was not vigilant in assessing all of the needs of the patient. The next case that's going to be discussed is borderline case. And for the borderline case, as Chin and Kramer described, they define it as a borderline case involves a metaphoric or pseudo-application of the concept. It requires the use of the concept in an unrelated manner. So the case study that I have done is Sandy has been a full-time RN in a small community hospital for 1 year. She has recently taken a position in the pediatric ICU at a large healthcare facility. The last 3 months, she has been off of orientation and assuming the care of more complex patients. She has noticed that some of her colleagues are complaining about nurses not completing their charting. These nurses have indicated that hourly vital signs are the standard of care in the ICU and that abnormal vital signs must be reported. Sandy does not wish to let her co-workers down. She assumes the care of a 12-year-old boy who sustained a subdural hematoma in an ATV accident. He's on a ventilator, requires sedation. She begins her shift by reviewing the normal vitals for a 12-year-old child. She even writes the normal limits across the top of her assessment sheet. In an effort to remain vigilant about vital signs, she spends a large portion of her shift watching the cardiac monitor. She even calls the physician twice to report decreases in the patient's blood pressure outside of the normal limits. She reports the patient appears comfortable and maintains a pulse oximetry reading at 100%. At 3 a.m., the patient's blood pressure drops to 50/24. Upon notifying the physician, she is instructed to hold the propofol drip and administer a normal saline bolus. The physician arrives to find the patient's abdominal dressing saturated with bright red blood. Through her desire to remain vigilant about her vital signs monitoring, she fails to realize the obvious cause of the patient's hypotension, thus neglecting her duty to maintain professional nursing vigilance.
I'm going to talk about the related case. Related cases are instances that represent a different but similar concept. Related cases usually share several criteria with the concept of interest, but one or more criteria will be particularly associated with it. That was according to Chin and Kramer. According to Walker and Avent, related cases help us to understand how the concept being studied fits into the network of concepts surrounding it. In the following case study, the concept of nursing awareness will be used to demonstrate a related case to vigilance. Kim has been a pediatric nurse for over 25 years. She has been employed on the same unit her entire nursing career. She normally works on the main pediatric floor and feels somewhat intimidated when pulled to the pediatric intensive care unit. But due to her nursing experience, she is required to fill in on occasion when she is needed. Upon Kim's arrival to work for her night shift, she is told she will be working in the PICU for the night as the second nurse. She is a little hesitant but gathers her things and heads to the unit. She is assigned a 3-year-old patient that presented with asthma exacerbation. The child is currently on Vapotherm, receiving nebulizer treatments every 3 hours. Kim is experienced in watching for the signs and symptoms of respiratory distress. She is aware of what problems the child may exhibit if he starts to have trouble breathing. Upon initial assessment of the child, he's found to be breathing comfortably and maintaining adequate oxygen saturation. After a few hours, Kim notices the child's respiratory effort has increased and his oxygen saturation has decreased. She calls the respiratory technician to administer a breathing treatment and decides to increase the oxygen concentration on his Vapotherm. Kim was able to quickly detect when the patient started to exhibit signs of respiratory distress. Due to Kim's nursing awareness, within the hour the child's respiratory effort is decreased and he is breathing comfortably once again. His oxygen saturation is again within accepted range and he is soundly sleeping.
One of the next cases I'm going to go over is an incentive case. Walker and Avent state that these cases contain ideas outside of our own experiences, often read like science fiction. The authors go on to state that the invented cases are where a typical situation is placed into an invented situation and cannot possibly be considered realistic. The following scenario is a case study that we came up to on invented cases. We have Zeus as a 34-year-old male with a post-traumatic stress disorder from past encounters with beings from another planet. On a routine home visit from his home health nurse, the nurse finds the home cluttered with multiple charts covering the floors, the wall, and his furniture. She notices in her assessment of the patient that he is pale, he's tachycardic, he has a flight affect, and appears clammy. He tells his home health nurse that he has not had time to eat or sleep for the last 2 or 3 days. He is noticeably anxious and reports to the nurse that he has to finish analyzing the data for intergalactic relationships between humans from the Earth and those from the planet Saigon. Zeus is displaying vigilance to his assignments from the aliens by his willingness to put the wishes of the aliens before his own well-being. Realistically, the nurse is being vigilant based on her physical findings of the patient to obtain proper care for him because he is mentally unstable at the time and needs further assistance at an inpatient psychiatric hospital for continued evaluation and treatment for the patient. And this is all based on vigilance as a definition according to Avent and Walker. Next, we have a contrary case by Chin and Kramer. Contrary case is cases that are clearly not illustrations of the concept, although there may be some similarities. A majority of the observers would clearly recognize a notable difference. We're going to go with an example of an experienced nurse working full-time nights in the pediatric ICU. She's also attending school full-time. She has just received a report on her patient, an 8-year-old female, recently extubated following a motor vehicle accident with a traumatic brain injury. The patient is neurologically appropriate, but is noted to be very tired. Continued nausea and vomiting from the patient has been reported by the day nurse with vital signs within the normal range for the patient's age. The day nurse briefly mentions a concern about an increase in the urine output. Neurochecks are ordered every hour. The ICU flow sheets allow for hourly recording of vitals, neurochecks, fluids, vent settings, in and output calculations. Since it's been reported that the vital signs have been stable all day and the parents are at the bedside, the nurse has decided to let the patient rest for the night. She performs some brief neurochecks every 1 to 2 hours, and around 4 a.m., the nurse has to call the doctor with a change in the patient's status. The patient is now having increased nausea and vomiting, along with a significant increase in the urine output. The doctor asked for a urine output total along with urine output calculated in cc's per kg per hour, being concerned for diabetes insipidus. The nurse is unable to give the values to the doctor at the time due to not calculating the urine output in cc's per kg per hour as the flow sheet indicates. Instead, she has just been jotting down the totals and figured she would just measure it and total it up at the end of her shift. Lab work ordered by the doctor revealed that the patient was indeed presenting with diabetes insipidus requiring additional treatments and interventions. The nurse had lack of vigilance on her part by not closely watching the patient and being observant of what the nurse had previously said in report, or she would have caught on to the fact that he was having already increased output, and she was lacking vigilance as in not recording the output and input as ordered every hour and neurochecks every hour as the doctor had ordered.
Okay, I'm going to discuss the antecedents and consequences with vigilance. Antecedents are the events or incidents that might occur or be in place prior to the occurrence of the concept, according to Walker and Avent. And we had discovered there was a couple of the antecedents that led to the occurrence, that could lead to the occurrence of vigilance. Caring, empathy, compassion, devotion to patients, professionalism, and experience. Some of the consequences, on the other hand, are the events or incidents that occur as a result of the occurrence of the concept. According to Walker and Avent, we have derived several: skilled observation, positive outcomes for patients, decreased risk of errors, increased awareness of the importance of vigilance, and promotion of knowledge. We have discussed and tried to define an operational definition, and according to Meyer and Levine, vigilance is defined as a state of watchful attention, of maximal physiological and psychological readiness to act, the ability to detect and react to danger. Furthermore, nursing vigilance is a scientifically, intellectually, and experientially grounded state.
So in summary, as we've discussed, professional nursing vigilance is found within each task and skill and is accomplished through caring. We have established through this concept analysis of the definition and distinguishable roles of vigilance to be in nursing profession. A functioning definition of nursing vigilance has been established through the identification of defining characteristics and a review of the applicable literature. It is only through action, however, that others can see that the vigilance has occurred.